and it's not something I wanted to do. But I've said all along in this process that this is a fluid process and that I would listen to the science and public health experts to make the best decision possible for the people of the state. And that's why I made the decision that I did yesterday to have Secretary Palm issue today's order. The bottom line is that COVID-19 has been and continues to be a rapidly evolving situation, sometimes changing by the hour. That means that sometimes our responses have to change as we have more information. And if you're going to prevent and manage the further spread and ensure that the healthcare workers and the system aren't overwhelmed, then that means we have to be willing to act as quickly as we are able to do to keep people safe. And that's what's always going to be the bottom line for me, keeping people safe. Our deepest sympathies are with the families and friends of those who lost someone to this virus. I was struck by the profound statement from a family member of one of the deceased. This is a quote from his obituary. "We ask you to be serious about COVID-19. Please do not panic, rather educate yourself and your family. Please do not blame or shun, rather be supportive and compassionate, especially with the people who have tested positive for this virus." Now, I recognize that a lot of folks out there have had questions about the order, and I recognize this is a difficult time for our state and our country. At the end of the day, folks, we are all in this together. And during the most difficult times, we are called upon to remember our Wisconsin values of kindness, compassion, empathy, and respect. So to that end, I'm going to continue to ask for your help, not only to remember these values, but to do your part to keep our friends, our family, and frankly, most importantly, our healthcare workers and communities safe. We need folks to take the Safer at Home order I signed today seriously. Folks do not need special permission to leave their homes. You can still go outdoors, walk your dog, go to the doctor, go to the pharmacist, and get other and groceries, and get all the supplies that you need. But this is important. We need to have folks limit their interactions to the same people, not different small groups. Shrinking your circle of interactions will help prevent the spread of COVID-19 to make sure our healthcare system doesn't become overwhelmed. Unfortunately, that means no potlucks, no play dates, and no dinner parties. And if you have to leave your home, please stay 6 feet away from other people. As I also mentioned yesterday, some businesses will continue to be allowed to operate. So no need to run to the grocery store and hoard food. Healthcare operations, grocery stores, pharmacies, gas stations, banks, critical infrastructure, and businesses that ship and deliver groceries and foods and goods directly to residences, among others, will continue to stay open. Over the past several days, we've been working with public health experts, local governments, stakeholders, business leaders, to determine how we can best keep folks safe while continuing to provide the essential services and keep our economy strong. If you have questions about whether your business is essential or non-essential, please review the Safer at Home order. And if you have any additional questions, please visit wedc.org/essential business for other details. In addition to our Safer at Home order, we are also working to ensure that our healthcare and essential workers have access to child care in Wisconsin. Last week, my administration convened a broad group of stakeholders to determine what child care options were available to healthcare workers and what child care needs existed within the healthcare community. Over the past 48 hours, we've begun connecting the dots for those folks with child caregivers. We also put into motion the plans for new on-site child care facilities. I fully expect the coming weeks to see these operational. These are operational in areas of high demand. Now, I just have to go back and talk about one thing in particular. All this is about making sure that our healthcare workers, our emergency responders, and others that are helping save lives and prevent this virus from expanding to do their work. It is very important. And I also want to thank some people that are helping us in doing that. So I want to acknowledge a few key partners: the Wisconsin Hospital Association, the Wisconsin Early Childhood Association, Supporting Families Together Association and Registry, and staff and leaders from DHS and DCF. I want to give a big thanks to the child care providers who are keeping these kids healthy and safe and adapting to this rapidly evolving situation. On a separate note, I'd like to thank the Wisconsin Dental Association that has offered personal protection equipment, which includes 20,000 masks, 25,000 gloves, and 1,700 gowns. We are coordinating with the Wisconsin Emergency Management System to arrange for the transportation of this material back to a Madison warehouse for redistribution to facilities in need. So I want to thank all the folks who are generously working to help us get the supplies we need to our healthcare workers and systems across our state. And now I'd like to introduce Secretary-Designee Andrea Palm from the Wisconsin Department of Health Services. Andrea?
Thank you, Governor. And thanks to everyone for joining us again today. I'll start with where we are. We have 8,237 negative tests, 457 positive tests, and we remain at 5 deaths in the state of Wisconsin. Today, as the governor mentioned, he did direct me to sign the Safer at Home order, which I have done. As the governor said, this decision was not made lightly, but it has become necessary to stem the tide of COVID-19. It was made by listening to the advice of our public health experts, and it is abundantly clear that you are safer at home. I've heard some people question why we're doing this when there are only 457 cases and 5 deaths in a state as large as Wisconsin. Our state benefits from the experience of others who have come before us in this pandemic. Our experts are comparing our data to the Wuhan and Italy experiences to predict what is likely to happen here in Wisconsin. And if we continue on our current path without implementing Safer at Home to flatten the curve, the models show us that we would likely have 22,000 Wisconsinites who are positive for COVID-19 by April 8th and an estimated 440 to 1,500 deaths. This means thousands of Wisconsinites would need hospitalization, and we would exceed our current capacity, our current hospital bed capacity. Yesterday, we heard from the Wisconsin Hospital Association, the Rural Wisconsin Health Cooperative, Leading Age, the Wisconsin Healthcare Association, and others representing frontline healthcare and long-term care providers, urging the public to take all steps available in order to help manage the limited resources they have to take care of patients during this pandemic. Keeping our healthcare system from becoming overwhelmed is our #1 priority. Remember, there are no medications or vaccines to protect us from this contagious virus. The only tool we have is physical separation from each other. I implore you, stay at home. We have to stop this virus from spreading any further. Limiting your contact to less than 5 people total will help do that. Not 5 people at a time, but 5 people total. So that means, as the governor said, no dinner parties, no sleepovers, no kids at the playgrounds, no gatherings. We need you to be in physical contact with as few people as possible. And I think I would just drill down on that just a little bit. As we learn more about this and we understand that transmissibility happens before symptoms, this physical separation, this working to be in contact with as few people as possible becomes more and more critical because we don't necessarily know who is positive and therefore who is spreading it. While you are safer at home, the Department of Health Services, along with the governor, the State Emergency Operations Center, and our private sector and healthcare partners are working together to prepare for what is ahead of us. We continue to trace every confirmed case of COVID-19 to find anyone they may have exposed and inform them so they can go into isolation. Isolation not only means staying at home, but staying in a room that is away from other members of your family so that they are not exposed to COVID-19. This critical public health work will allow us to isolate any people who are potentially exposed and will stop them from spreading COVID-19 to others. To help us do this critical work, we have redeployed 60 public health professionals to aid our local public health departments in this effort to do contact tracing. As the governor mentioned yesterday, contact tracing is just one of the 6 strike teams we have been working, that we have stood up to be working on our biggest challenges that we're facing with the COVID-19 pandemic. The other strike forces working at the State Emergency Operations Center are focused on surge planning, on personal protective equipment and other essential medical supplies, our lab capacity, isolation facilities, and finally, as you heard from the governor, childcare for healthcare workers. The Department of Health Services, doctors, nurses, public health officials, and other staff across the agency are working with our healthcare system partners, leaders from Epic Systems, and the National Guard to plan and execute this work within the strike teams. There will be more announcements from them in the coming days. While we continue to focus on that work, one thing I'm asking of all of you today is to make some time and think about how you and your friends and family are handling safer at home. This is hard. Humans are social beings, and we're not wired this way. And this COVID-19 pandemic and the resulting changes in your life and your lifestyles can make anybody anxious and even depressed. Do not hesitate to ask for help if you're feeling overwhelmed. Some resources that we have available: call 800-985-5990. Again, that's 800-985-5990 to speak with a trained crisis counselor or text "Talk with Us" to 66747. Other resources to maintain your mental health and well-being can be found on the DHS COVID-19 webpage, and we will certainly continue to talk about this issue moving forward. But also, you can call and check in on people, see how they're coping, FaceTime with grandma, Skype with your neighbor, Google Hangout with your friends. Stay connected to your support system, because we are going to need each other to get through this, but we can do it together. Thank you almost seems inadequate in expressing our gratitude to our partners who are working alongside us to flatten the curve, especially our diligent local health and tribal health officers and our healthcare providers who are on the front lines of this pandemic. The same can be said for private sector partners, business leaders, and business owners who have been so willing to help and have stepped up to ask how they can contribute to the efforts. But our deepest sense of gratitude is for the citizens of Wisconsin. As I said earlier, nothing we have asked of you or will ask of you has been decided without careful thought and deliberation. And true to this state's spirit, you have risen to the challenge each time. We will get through this. It will take some time, but there will be a day when you can go back to work, your kids can go back to school, we can shop, go to the movies, and do all those things that make our lives richer. Like you, I look forward to that day. Until that day comes, thank you again for all that you are doing. We will continue to be transparent and provide timely information as this crisis evolves. Please be safe.
Thank you, Secretary Palm, and good afternoon. I'd like to share some updates related to our public health response and describe some of the issues that we're working on in partnership with our healthcare partners during this very challenging time. First, wanted to correct something that I mentioned in yesterday's briefing that was inaccurate. I'd said that we had about 10% of individuals tested positive for COVID-19 that were hospitalized. In reality, we believe that number is higher, probably as high as 20%. And the reason for that discrepancy is that The way that we collect information about positive cases comes directly from reference labs rather than hospitals themselves. So we've learned that in a lot of cases, the information about whether a patient is hospitalized at any given moment is missing. So it's one of the things that we're really working hard to do is to develop new, better, and innovative strategies to look at a large number of data sources so we can keep very close track on the critical health system resources and understand exactly who is hospitalized and who's requiring critical care. There are two important things that we've learned from research about the virus that I think need to be underscored to really talk about why this is such a grave situation. The first is the very high proportion of individuals who contract the virus who will have mild symptoms. So that's good news and bad news in the following sense. We've learned from other countries that as many of 90% of people who have the infection don't require symptoms that require medical care. And so since we've generally test people in the setting of a medical evaluation because they have symptoms, that could mean that for every individual that we test that tests positive for the infection, there are 10 individuals in the community with mild symptoms that don't seek care. So we're having a small number, hundreds of cases in the state, but it would potentially be thousands right now. And there's potential that people will develop increasing or worsening symptoms in the future. That's another thing that we've learned about the virus, is that sometimes initial mild cases can become more severe. The second thing we've learned about the virus is that it's very highly transmissible, even from people who have mild symptoms. When we've studied the data from the other countries in terms of the speed and the size of the outbreak, we've learned some of these important parameters about this epidemic. The first is the reproductive number, or how much we expect, how many additional cases we expect to become infected for every one case. That number is between 2 and 3, which means that for every person we might have 2 to 3 more people infected. Other parameters around that we talk about are in terms of the doubling time. How long does it take for the number of people who are currently infected to exceed it by a factor of 2? And that number in other countries has been around 6. But we've seen in this country and other settings that the number of cases reported in some states has doubled in as few as 2 to 3 days. So we're very concerned, as the Secretary mentioned with some of these modeling, that this could develop much larger very quickly, and it's really why that's really the justification for the measures that we're talking about. So the science is pretty clear that the measures we're taking for the entire state in terms of limiting our physical contact is really the main tool that we have to address the crisis, and if we do so well, we can save many, many lives. The last thing I really wanted to echo that we're addressing and really focusing on in public health is that these social distancing measures that we're recommending are themselves not without risk. So to use a medical analogy, many times the treatments that we prescribe for disease have a risk of side effects. In cancer care, we can cure very aggressive tumors, but the treatments that we required sometimes make people feel quite awful and can be very toxic. So the intervention that we're recommending for this pandemic recommends isolation, social distancing. Social isolation can be very toxic for people. It can make people feel awful. So we really want to draw increasing attention to the idea that while we need to have physical distance between people, we want to do everything we can to stay socially connected, and the resources that the Secretary mentioned are great examples of this. In healthcare, we're also really focusing on using innovative tools in telehealth and telephone-based interventions to make sure that people feel connected to their source of medical care, particularly in mental health care. Finally, I just wanted to echo the sentiment that the Governor and the Secretary mentioned and just to express our profound gratitude in those of us working in medicine and public health. I acknowledge it's difficult to really conceptualize and see what a historic threat this is when we have such small number of cases, but that we've learned enough about the virus and we've observed enough about the epidemic in other countries to know that this is truly a grave situation, and all of the things that we're recommending we understand are not easy, and if we do them well, they're going to seem like tremendous overreactions, because that's going to mean that the virus, the epidemic did not get too far out of control and become too large. But that's really our goal, and we really appreciate the support of everyone as we get through this together.